I feel very grateful for. I get to be in conversation as an educator about psychedelics to the public, to professionals like lawyers and doctors, but also to legislators. I spend a lot of time now speaking with people who are elected, both in the United States and as well as around the world, around like what psychedelics are, how they work, and in many cases, as I can go into more later, how to talk about them without sounding crazy. And there are a lot of people who are interested and who are kind of interested in the closet, but what's happening is that the barrier to entry to talking about psychedelics is starting to reduce. I think a lot of you may be familiar, but MAPS is a nonprofit that was founded in 01986. I don't know what the naming convention is when you add the 0, but I thought that'd be cute. And we've been sponsoring psychedelic-assisted therapy trials for the last 20, 25 years, and we educate people to benefit from the careful uses of psychedelics and marijuana. So we're really an educational research organization that is really looking toward kind of, I think for a long time the frame, and this is true of a lot of drug policy, the frame was how do we dismantle the current system? And what I've realized, and a lot of what MAPS works on, and what I work on with my colleagues that are here in other places, is the kind of the building of the alternative infrastructure. Like, what is it that we go to? We can kind of dismantle the war on drugs, we can end mass incarceration, we can do all those things, and I really believe that we're slowly but surely moving toward that. But there will need to be systems that catch people, because right now the only ones we have are the ones that are broken or fundamentally working exactly how they're supposed to, depending on your frame. So MAPS is the sole owner of the MAPS Public Benefit Corporation, which was founded in 2014. And that organization works for drug development. So it's essentially a small pharma company that's working toward therapy education and creating FDA-approved drugs. So right now our flagship project, which I'm sure a lot of people are familiar with, is taking MDMA through the FDA approval process. And I'm happy to announce that we recently announced we just completed our second phase 3 trial, which means we're now in the last leg before submitting the NDA to the FDA, hopefully this year. MAPS has 7 principles that we operate on, and I think that they kind of help give a sense of the conceptual arc and the type of work that we're trying to bring to the world. Healing for all, prioritizing public benefit, open science, open books. I love this one because I'm all about how do we make things accessible to the public that are usually esoteric, unavailable knowledge. Set the setting. Some of you are familiar with the concept of set and setting, but we kind of believe in this idea of setting the setting. Like we're actually building out the setting in which political change, prohibition will change, and so on as we speak. So there's this idea that we actually have some agency there. This idea of consciousness without criminalization. I'll talk a little about criminalization and decriminalization specifically later on. And this idea of being the bridge, we have a really kind of a wide umbrella under which we work, and you can imagine, and as you've seen more and more politically, and I think Andrew and I will talk about this a bit in the Q&A, the type of people that are attracted to psychedelics, it's not really just one type of person anymore. There was that concept for a long time, but that's really not true. I think it never was, but there's this idea that there's a particular type of person who like looks a certain way and maybe smells a certain way that's into them. But that's really starting to change. And the final one is my favorite, which is seeing past the paradox, which is just a general concept when we approach these big, complex questions that relate to criminalization in our future and where we go from here.